We've just arrived in Haiti. These are all of the things that are going to our camp. Everything is really about as organized as it can be, considering we've just dropped into an earthquake area. Fortunately, we've found pretty much all of our bags so far, and we're getting ready to head off to the compound. This is the mini emergency department area that we've set up in Port-au-Prince in the compound we're in. I've already taken care of a very badly infected head injury. It was treated apparently right after the incident by some Mexican aid workers, is what the father had said, as well as I think subsequently maybe some Colombian health workers. The child had an enormous skin flap that was torn off, and they had put a drain in. It had become infected. Frankly, it smelled of Pseudomonas. There was absolutely nothing that I had available to me other than to change the wound, irrigate it, close the flap a little bit tighter actually, because they had not closed the galea over the skull. Irrigated it out, provided tetanus prophylaxis as well as some antibiotics, and instructed his father that he really needed to try and get him to more aggressive medical care, because he also had an enormous defect above his eye that was clearly not going to heal in well either, and that seemed to be infected too. Had a woman with a both bones forearm fracture that she sustained almost 8 days ago. She's been wearing a cardboard box for a splint, and just all kinds of other crazy injuries and infections that not necessarily that we wouldn't see in America or in the States, but not under these circumstances. I can honestly say that flies are totally out of control. Any open wounds, the flies immediately flock all over. Any dressings that are left out, anything that has blood on it, immediately collects flies. So sanitation, controlling the smells and the garbage is really critical. But this is, frankly, about the worst circumstance that I've ever tried to practice medicine in. But it's been good in the sense that I think I'm definitely able to help people. But it's difficult and frustrating because although we can help people, there's only so much I can do with the supplies that I have. It's also amazing to me how many of the population have come to me for chronic medical conditions like an infected tooth or an ingrown toenail, and they just haven't seen a doctor because they can't afford to go to the hospital that apparently charges them more than anyone in this area of Haiti can afford. So it's pretty rough going right now. And right now we're focusing on essentially basic sustenance and just getting by with... Have you been a pediatrician again?
22 years.
22 years, yeah. And what are the biggest problems?
She got Keflex just today.
Right, Keflex, right. She started the Keflex today.
Yes, because I gave her a prescription. She
right.
Fill it out, yeah.
But even with the prescription, she couldn't get it.
She couldn't get it.
Describe again the biggest medical problems, infections that you see here in Haiti. Parasites?
Because they taking amoxicillin for anything, for as a painkiller. They use it as a painkiller, as an antibiotic. They taking it even though they don't have anything to related which can be treated by it.
Mm-hmm.
Okay. Then when they have a problem, an infection, you cannot give them the amoxicillin because they develop resistance because they've been using it so often, so that they develop resistance.
What's your second line then? What do you usually use once they've developed resistance?
You use augmentin.
Augmentin,
with,
yes.
Acid carboxylate.
Yes.
And you can use This
Yes.
or penicillin,
Biaxin? Clarithromycin?
erythromycin.
Yes, yes,
Yes, right.
yes. Expensive though.
No, erythromycin
No?
is not expensive, but
No.
Biaxin is expensive.
It's Friday the 22nd. We're in Port-au-Prince still. This is the compound that we're in. You can see 12-foot high concrete fences and razor wire at the top. The rest of the environment is, you know, a little questionable, but overall we're very safe inside of here. But we are going to go to the airport right now and try and secure water for the camp, as well as additional medical supplies and a connection to hopefully a doctor on either the Comfort or one of the other medical relief units that can help me take care of any more injured patients that I see that I can't manage in the small clinic that I've set up here in the compound. We're on our way to the airport right now on the streets of Port-au-Prince. People drive a little crazy here, that's one thing for sure. Riding in the back of a open pickup truck, pretty much the best way to get around. You see collapsed buildings pretty much everywhere. People still trying to dig survivors out of the rubble, even this many days after the fact. Right now it's Friday. About a massive recovery effort and heavy equipment, but everywhere we go, all we see are buildings collapsed and no one digging anyone out.
Somebody done pulled a little hole.
Somebody may.
With hammers, it done went into that little place there, trying to get people out.
Somebody may have tried getting people out at one point, but right now,
some people.
I don't. Yeah, I don't know where the recovery effort is, but it's not here. That's for sure. There's plenty of places where
Look at that, somebody done boarded that.
there's absolutely no evidence of recovery effort. I don't know where it is that they're showing on TV, but it's not in this part of Haiti. There's tents everywhere. This is where people are living now, till they can find something more permanent. It's crazy. They're just holding them up with sticks. I just saw some people who had a lot of sprains and strains. Back pain seems to be a big problem right now. But there were doctors here before, and they were able to take care of some things, not completely, but pretty well. So I'm actually surprised. The tent city is getting fairly appropriate attention right now, especially since Doctors Without Borders has identified it and set up a camp.